I am Dr. Scott MacAdam, chiropractor for over 27 years. And one of the things I can tell you with absolute confidence, with seeing all those patients, and for my own life, being 54 right now, is stretching is one of the simplest, easiest, and probably one of the most important things that someone can do as they get into their later years, just to create an overall wellness in your life. It's absolutely doable, and you just have to make it a discipline in your life to do it. Each decade, as we get older, muscles tend to just get tighter and tighter. They tend to get more scar tissue, they get less elastic. And when you're in your 20s, if you remember back then, you didn't really have to think about it. You could go do whatever you want to do, any sport, and the next day you're back to your old self and you're doing whatever you want to do. Now, as you get into your 40s, at least for me, when I hit my 30s, I could pretty much do the same thing. I got to my 40s, and then I started noticing I couldn't do anything I wanted to do right away without practicing first or working out for it. I couldn't just go play a baseball game when I haven't played baseball for 10 years and not pay a price the next day, at least for a few days, feeling sore. I got in my 50s, and I absolutely had to start making decisions on what I chose to do and what I chose not to do based on where I was with my physical health and where I was with the ability of my muscles to be able to perform that. And I had to make decisions on where I was going to maybe not throw a football or a baseball with my son, and where I could, because I knew the risk of injury was much higher. Well, stretching is one of those things that you can do that can absolutely help you continue to do those kind of things and not hopefully pay a serious price of a serious injury, like a torn muscle or a rotator cuff tear, or just feeling really sore for the next 4 or 5 days after doing something fun on a weekend. So I'm going to show you some very simple stretches that you can do every day. And my recommendation, similar to brushing your teeth, my guess is you have chosen a certain time of day when you brush your teeth. Most people, it's in the morning when they wake up and before they go to bed. And why is that? Because it happens consistently then every single time you don't miss brushing your teeth or flossing your teeth. Well, same thing with stretches. If you find a time of day that is absolutely specific to when you're going to decide to stretch, it will happen. If you don't do that, my guess is you're probably not going to get real consistent with this stretching regimen in your life. So my recommendation is first thing in the morning before you hit the floor, your feet hit the floor, you start stretching. Set your snooze if you want. You can literally do the stretches I'm going to show you right now laying in bed as you're waiting for your snooze to go off again, and warm up in bed stretching your lower back. And then you swing your legs off the floor, which I'll show you now, and you're going to be able to do your neck stretches. And then repeat that when you go to bed at night. Before you hit the sack, you're going to sit there and do your neck stretches, and then lay back in bed, do your low back stretches, and then time to go to bed. If you do that every day, twice a day, I promise you, within 30 to 60 days, you are absolutely going to see a significant change in overall how you feel and your abilities. I promise you that. So let's start with the neck stretches. So these, again, you could just do sitting up on your bed at night, right? Getting in bed or waking up in the morning, you sit here, always put one hand behind you, okay? So you're going to feel that, stretch that shoulder a little bit. You're going to grab the side of the head with this hand, and you're going to pull. And the key here is pulling gently, not to where you create any pain. It's okay to feel a little tension, but if you start feeling any pain, it's going to be too much. You're going to get sore. And why is that? Because we're going to have you stretch for 60 seconds, which basically equals an eternity. If you're not used to stretching for 60 seconds, it's going to feel like an eternity. Most of us stretch for 10 seconds, 15, and we're done. 60 seconds is critical as we're doing these. Now you can go to this side, because it's changing something called a Golgi tendon reflex. It's basically like a sensor in the muscle, and you're resetting that. And when you reset that sensor, it says, oh, this is a new length that we need to be at now. And if you do this for 60 seconds, you start resetting that sensor. So those are the two side ones. Right here, switch arms, right here. The second two you're going to do is same thing. Arm goes behind you, but now you're pulling from behind your head, and you're pulling down at a 45-degree angle. Real simple, just like that. Coming across your body, 45, kind of like your nose going towards your armpit. 1 minute. Remember, each one's 1 minute. And then you can go this way. Okay, 1 minute. But no pain, just nice, easy tension so you feel the stretch, but don't create pain because you will get sore. You can absolutely get sore from overstretching, especially if you can do it for 60 seconds. Now, as you get more advanced and you feel like, hey, that minute's not enough time, go longer. I'll go to the gym and literally do some of these stretches and push my low back, and I'll sit there for 5 minutes on one side just feeling that stretch. It's okay to go longer, but just don't go harder. Okay, now let's go to the lower back. So now, laying in bed, either morning or afternoon, and you start off with a very simple knee to chest. Grab the knee here, relaxed, and just pulling it toward your chest until you feel some nice tension. And again, you hold this one leg for 1 minute. And then you can do this leg, 1 minute. And then do both together, 1 minute. You can rock back and forth a little bit if you want, but just 1 minute. So there's 3 minutes right there for that one. Then you're going to do this stretch where you got one leg here, crossed over, hand behind you, support yourself. Again, you can still do these in bed. Elbow goes on the knee. Big breath in, blow it out, and twist. And find that point of tension. Now you might stop pretty quickly because you're tight. Feel the muscle give, tighten up a little bit. Big breath in, then you might be able to go a little bit further. You know, kind of go with your body and let it what it's allowing you to do. But you keep challenging it. You can go further if you want, but don't go to where you start getting spasms or pain. Like right here, I start to feel a little spasm come my lower back, so I'm going to back off a little bit. And that's it. You just listen to your body is the key. Don't fight it. And then you switch. Come over here. Blow it out and just twist. And again, I'm kind of pushing off this leg right here to help out. My back arm is just supporting me. And I'm just pushing. Go like that. Boom. There's my low back stretches. How tough is that, right? Actually, I forgot there's one more. So then we're going to do another one. This is actually my favorite, so I don't want to forget this one. This one you're going to lay like this, and you're going to pull that leg over. Your head goes the opposite way, arms here, and with using this hand, you're pulling down. So it's almost like wringing a towel. Now don't let your shoulders come up. Don't rotate your upper body. Keep your upper body flat. That's why you want this arm over here. And just pull. 1 minute. Again, this is the one I'll do at the gym for like 5 minutes because it feels so good. And then head goes this way, arm here. Keep the shoulders flat. Pull. And you should be feeling it right all through here. Boom. Okay? So how hard is that? That's something we all can do every single day, and it'll make a huge difference in your life. Well, I hope that helps. Again, it's all about making choices and making decisions on a consistent daily basis. If you ever need a chiropractor, I encourage you to reach out and find a chiropractor near you. If I could ever help you find one in your area or you live in my area, I'm happy to be able to sit down with you and see if we can help you find more vitality in your life.